Hello everyone, am I audible and visible to you? Okay, so myself Dr. Shital Ghataliya, your faculty for Physiology. Welcome on the platform of Unacademy. Welcome to Unacademy Future Doctors. I'm your faculty for Physiology. I did MD Physiology from MP Shah Medical College and I'm educating MBBS and MD students. I have teaching experience of more than 17 years and I am one of the experienced faculty for integrated curriculum teaching. Let us go through some subscription details of Unacademy. With the Plus subscription, you can have access to both live as well as recorded classes. You can learn from the topmost educators of India. You can compete in live tests and quizzes. You can study on the device of your own choice. You can have access to the question bank having more than 25,000 questions in it. You can even have a printed notes available with certain subscription. Let us go through iconic subscription. With iconic subscription, you can have access to the best from two of best. Unacademy and Peripheral. With Unacademy, you will find various resources like well-structured live batches, recorded classes, competitive live tests and quizzes, and many more. Unacademy and Prep Ladder. With the Prep Ladder, you will find clinical and integrated essentials, video lectures from Dream Team, rapid revision and snapshot, and many more. So both are unique in its own way. Whatever is best suitable for you, that you can choose. Now Unacademy came up with special class feature. Now classes will be highly interactive. There will be a poll for learners. You can raise a hand, interact with your educator. You will never miss a class because Unacademy will send you regular notification. You will have a lecture notes. You can download it and you can even have access to the recorded sessions. You can learn from any time, anywhere. As I told you, there is a highly effective question bank. So more than 25,000 questions, high yield clinical questions are there, which are based on latest exam pattern, and it includes detailed explanation. These all are toppers of NEET PG September 2021. Congratulations to all the toppers from Unacademy. As I told you, there is a feature raise a hand. So now classes will be highly interactive. You will be engaged with the quizzes, Viva, doubt solving, and many more. Unacademy medical PG tests are there. There are free test rituals where you will find educator curated test series, FMG grand test series, study with me YouTube test series, and many more. Plus based test rituals. There is NEET PG 2022 subject wise test series, NEET PG 2022 grand test series, and many more. So there are two batches, Focus FMG 2022 comprehensive batch. Duration is 6 months, already started from 15th of December. Target NEET PG 2022 test and discussion batch. Duration is 3 months, already started from 15th of December. So NEET PG subscription, iconic subscription and plus subscription both are available with various duration and different prices. You can use the promo code SHITAL10 to get discount. There is a surprise NEET PG combat is here for you, so you will have a chance to be a lucky winner. 50 participants will be rewarded with the Amazon gift voucher. It is valid till 23rd of January. NEET PG Mega Combat is there. There will be a test of 60 minutes with 45 questions. 50 lucky participants will have will be winning the Amazon vouchers worth rupee 5,000. So NEET PG Combat, there are questions will be from the medicine, dermatology, anesthesia, psychiatry, and radiology. You will receive the rewards from the pool of rupees 10 lakhs. You will also have a chance to get scholarship. Free taste on Unacademy is there. Educated curated tastes series. Scholarships are there. Okay, see this time and date. 17 January, 22nd January, and 28 January. Different subject tests are there. Check with the time and date. Use the code Shital10 to unlock the free test. Now there is an open house session with me. You can have a free question and answer open house session. So I am going to cover topic that is blood pressure and its component on 23rd of January 9 a.m. morning. Okay, so it is free question and answer open house session. So join me there. This is the code for the live click quizzes available on the application. You can use the code to attend the quiz. Now come to today's topic that is hemoglobin. The word itself says in the questions in physiology, I used to tell this that you are supposed to catch the word hemoglobin. Hemoglobin is an oxygen carrying pigment. Hemoglobin is red colored compound. Okay, red color oxygen carrying pigment in the RBCs of vertebrates. Right, there can be different oxygen carrying pigment in the lower animals like which are in blue in color, responsible for blue colored blood. Okay, in vertebrates oxygen carrying pigment is hemoglobin, which is red in color. So the color of the blood is red. So hemoglobin is oxygen carrying pigment in the RBCs of the vertebrates. Let us go through the structure of hemoglobin. As the word says, it is composed of two things, heme and globin. Now, what is heme? Heme is iron containing porphyrin. It is iron containing porphyrin. Here, iron protoporphyrin 9 is present. In heme, iron containing porphyrin. Here it is porphyrin 9, iron protoporphyrin 9. So it is consists of porphyrin nucleus and iron. It is composed of porphyrin nucleus and iron. Iron is present in Fe plus 2 state. It is present in Fe plus 2 state. And porphyrin nucleus consists of 4 pyrrole rings. Okay, it is consists of 4 pyrrole rings. Iron is present in Fe plus 2 state and it is attached with the nitrogen atom of each pyrrole ring. It is attached with nitrogen atom of each pyrrole ring. So if we conclude heme is an iron containing porphyrin. It is porphyrin nucleus is formed of 4 pyrrole rings. Here Fe plus 2 is attached with each pyrrole ring. It is iron protoporphyrin 9. So this is about heme. Now come to the globin part. Globin is formed of polypeptide chains. It is formed of polypeptide chains. There are 2 alpha and 2 beta. In adult hemoglobin, there are 2 alpha and 2 beta chain. Alpha chain contains 141 amino acids and beta chain contains 146 amino acids. Okay, there are 4 polypeptide chain, 2 alpha and 2 beta, adult hemoglobin, that is HbA. Here alpha chain contains 141 amino acids and beta chain contains 146 amino acids. So there are in each heme molecule, okay, in each one hemoglobin molecule, there are 4 units of heme, right? 2 alpha chain and 2 beta chains are there, which are attached with the heme. Okay, so there are 4 ion. It means there are 4 ion atoms. Now this is very, very important. There are 4 ion atoms. It means it can bind one ion atom, one Fe plus 2 can bind with the 2 atoms of oxygen, or you can say O2. Okay, it means 4 ions can bind with 8 atoms of oxygen. Okay, or you can say 4O2. Okay, this is important from MCQ point of view. One hemoglobin molecule can carry 8 atoms of oxygen, or it can carry, you can say 4O2. Both are same. Okay, so this is important from MCQ point of view. Hemoglobin composed of heme and globin. Heme is iron protoporphyrin 9. In each hemoglobin molecule, there are 4 heme. There are 4 heme and 4 polypeptide chain, right? 2 alpha and 2 beta. In each heme molecule, there is ion present, that is in the ferrous state, Fe plus 2 state, right? And each Fe plus 2 can bind with O2, means 2 atoms of oxygen. It means one hemoglobin molecule can carry 8 atoms of oxygen, or you can say 4O2. Now come to some important definitions. See the words carefully. In physiology, I always say understanding the word is important. When you separate the word, you will be able to understand the content. Oxyhemoglobin, then carbaminohemoglobin, reduced hemoglobin, carboxyhemoglobin, methemoglobin, and glycosylated hemoglobin. Now come to the first one. See the word itself says oxyhemoglobin. Means here the hemoglobin is combined with oxygen. Okay, so you can it can be represented as HbO2. Okay, oxyhemoglobin. Then carbaminohemoglobin. Here the hemoglobin is combined with CO2. Okay, hemoglobin combined with CO2. Then reduced hemoglobin. See the word itself says reduced, means the hemoglobin which was bound with oxygen, now this oxygen is removed. So it is reduced hemoglobin. Hemoglobin from which oxygen is removed. That is reduced hemoglobin. Then carboxyhemoglobin. Okay, hemoglobin which is combined with carbon monoxide. Hemoglobin combined with the carbon monoxide. Then methemoglobin. See the word itself says methemoglobin. Here in hemoglobin, iron which is present in Fe plus 2 state, here iron is converted into Fe plus 3 state. Okay, it can be represented as HbOH. Okay, it can be represented as HbOH. Okay, so if the Fe plus 2 state is very, very important for binding of the hemoglobin with oxygen. If iron ferrous state is converted into ferric state, in that case it will not be able to bind with the oxygen. So this is important. The another form is glycosylated hemoglobin. See this one, glycosylated hemoglobin. In glycosylated hemoglobin, it is a derivative of hemoglobin A only. But here, glucose is attached. Glucose is attached with the terminal valine of beta chain. This is very important and something I will say frequently asked also. Here, glycosylated hemoglobin. In glycosylated hemoglobin, see the word itself says glycosylated means glucose is attached, right? So, glucose is attached with the terminal valine of beta chain. Okay, so it can be represented as HbA1c. HbA1c. So this is glycosylated hemoglobin. Its level increases in diabetes mellitus. Okay, HbA1c, its value increases in diabetes mellitus. And its value is very, very high when diabetes is poorly controlled. This is important. Value goes more than 8. Okay, in poorly controlled diabetes mellitus. So glycosylated hemoglobin. This is important to remember. Now come to the normal values. Normal values of hemoglobin. At birth, normal value of hemoglobin ranges from 18 to 23 gram per dl, or you can say gram percentage. Both are same. At birth, value is 18 to 23 gram per dl or gram percentage. In adult male, it is 14 to 18 gram per dl or gram percentage. And in adult female, it is 12 to 15.5 gram per dl or gram percentage. Okay. At the time of birth, it is relatively high. As the age advances, the count reduces. Okay. And adult male, it is 14 to 18 gram percentage, and in adult female, it is 12 to 15.5 gram percentage. 1 gram of hemoglobin, 1 gram 1 gram per deciliter of hemoglobin can carry 1.34 ml of oxygen when it is fully saturated. When it is fully saturated, that time, hello Ishu, good to see you. So when it is fully saturated, so this is again important calculation based MCQ, you can say. Okay, so let's take an example. If hemoglobin value is 15 gram percentage, and if it is asked that calculate the oxygen carrying capacity, so in that case what you have to do is you know the value of 1 for 1 gram, 1.34 ml of O2, right? So now you have to multiply it with the 15, 1.34 ml. Okay, whatever is the answer, that much of ml of O2 can be carried. Okay, so that is how you can calculate the oxygen carrying capacity. Okay, so this is again important formula based question, you can say. Now come to the functions of hemoglobin. See, first an important function, this goes without saying that it is important, for it facilitates the transport of oxygen, right? As I told you, hemoglobin, in that iron which is present in Fe+2 states binds with the atoms of oxygen, right? One hemoglobin molecule can carry 8 atoms of oxygen, but all the heme molecules which are present in hemoglobin, they will straightway will not bind all the atoms together. Okay, here what will happen, one heme molecule When one heme molecule bind with O2, it forms HBO2. Okay. When the second heme molecule binds, then it forms HBO4, right? When first heme molecule binds with oxygen, it increases the affinity of the second heme molecule to bind. Okay, then when the second heme molecule bind with oxygen, it increases the affinity of the third heme molecule to bind with oxygen, forms HBO6. When fourth heme molecule binds, then it will form HBO8. Okay, so this way, when one heme molecule binds, it increases the affinity of the second. When second heme molecule binds with oxygen, it increases the affinity of third one. So it goes and on. Okay, and so on. So increases gradually, it increases. That's why when you record it in the graph, it will show the sigmoid shaped. This you will be covered in respiratory system. Sigmoid shaped graph will be there. Okay, so that is because of the increase in the affinity. As hemoglobin, as the heme molecule start binding with the oxygen, gradually there is increase in the affinity for binding with the oxygen. Okay, so and all this can be affected by pH, temperature, and 2,3 DPG level, which is 2,3 DPG is a metabolic product of glucose in RBCs. Okay, so this all affects the oxygen carrying. Then the second function, that is transport. It facilitates the transport of CO2. It facilitates the transport of CO2. Oxygen from the lungs to the tissue, CO2 transport from tissues to the lungs, right? Hello, Aisha. So, CO2 in the tissue combines with the amino acids of the globin. Okay, unlike oxygen, which binds with the iron. Okay, whenever the CO2 is transported by the blood, by rule CO2 first get accommodated in the plasma, then it will be accommodated with the hemoglobin. Okay, here also it will bind. Here it will help in it will bind with the amino acids. Okay, then it is important buffer. The third function, it maintains the pH. It is important in maintaining acid base balance. Okay, hemoglobin is having a buffering capacity more as compared to plasma proteins. You can say approximately 6 times it is more effective buffer. Hello, Aisha. Hello, Ishu. Issue for Unacademy, I can help you. You can use the code Shital10. Okay, then hemoglobin binds with the nitric oxide. Okay, nitric oxide in the lungs. Now, this nitric oxide is a potent vasodilator agent. Understand the word carefully. Vasodilatation. Vessel. Vaso means vessel. Dilatation means relaxation. So it causes vascular relaxation. Okay, hemoglobin can bind with nitric oxide, which is a potent vasodilator agent, causes vascular relaxation. So these all are the important functions of hemoglobin. First, it facilitates the transport of oxygen from lungs to the tissues. Then it facilitates the transport of CO2 from tissues to the lungs. It helps in maintaining pH, acid-base balance. It is important buffer. And hemoglobin. can bind with nitric oxide, which is a potent vasodilator agent, so causes vascular relaxation. Aisha, you can refer the book for physiology. I will insist that you read Guyton and Hall and Genon. These two are important book for undergraduate as well as postgraduate level. You can even still refer the market for the notes availability also. I am not getting your question. आपने you write heparin, atrial natriuretic factor. Like what you exactly want? What you are trying to ask? I am not getting you. Now come to the disadvantage. What are the disadvantages? See, hemoglobin is encased within the RBC. Okay, it is encased within the RBCs. So what happen if hemoglobin is free? Why it should be inside the RBC and why it is not free? If hemoglobin is free in the circulation, in that case what it will do is it will cause increase in the viscosity. Increase in the viscosity. Now what is viscosity? Viscosity means lack of slipperiness in the adjacent layer. Whenever the blood is flowing through the vessel, if the viscosity increases, the slipperiness is lacking. Okay, so it is a lack of slipperiness between the adjacent layers, okay, of the flowing blood. Okay, so if increase in the viscosity is there, so it will be increase the resistance for the flow. Increase is the peripheral resistance for the blood flow. If peripheral resistance is more, then it increases the blood pressure. Okay, peripheral resistance is one of the important determinant of the blood pressure. Okay, blood pressure is determined by two factors, cardiac output and peripheral resistance. So peripheral resistance, if it increases, blood pressure also increases. Okay, so that is one disadvantage, that if free hemoglobin is there, it will increase the viscosity of the blood, so it increases the peripheral resistance, so it increases the blood pressure. Then it also increases the osmotic pressure. Try to recall the previous classes. Osmotic pressure, okay, because the free substances, free colloids are present, colloids and crystalloids, which are responsible for or you can say osmotically active particles, free osmotically active particles. Okay, it increases the osmotic pressure of the blood. So in the blood, if osmotic pressure is more, okay, in that case what will happen? It will drain the blood at the capillary level. It will take the fluid from interstitium, right? So it increases the blood blood volume, okay, because it will take the tissue fluid from interstitium. It will take the fluid, okay, wherever the osmotically active particles are there, it will attract the blood towards it, right? So increase in the osmotic pressure of the blood, it will cause fluid movement inside the vascular compartment, so it will increase the blood volume. If blood volume is more, then it will increase the blood pressure. So that is another disadvantage of free hemoglobin. Aisha, still I am not getting you your question about the resistance. Resistance, there are so many factors which determines the peripheral resistance. Out of that, one is viscosity of blood, which is important determinant of the peripheral resistance. Okay, out of that, diameter of the vessel wall. There are so many factors which determines the peripheral resistance. Okay, so in general physiology, I have covered about the this law. Okay, Poisson is low. So please refer that video for the viscosity of the blood and resistance to the flow, how different factors which are affecting the blood flow. Okay, it is 8 eta L upon pi r raised to 4. So resistance to the flow is directly proportional. Eta stands for viscosity. Okay, directly proportional to the viscosity and length of the tube. And it is inversely proportional to the fourth power of the radius of the vessel wall. Okay, so viscosity, yes, viscosity increases the resistance because of the lack of slipperiness between the adjacent layer. So whenever the viscosity, imagine from the pipe, if blood is flowing, okay, and if something more viscous is flowing, then resistance to the flow will be more. As the content becomes more viscous, resistance to the flow will be more. So if the resistance to the flow is more, it means more pressure needs to be exerted for the flow. So increase in the peripheral resistance due to increase in the viscosity increases the blood pressure in the individual. Now come to another disadvantage of free hemoglobin. That is, if the hemoglobin is free, in that case, in the body, there is a RE system, reticuloendothelial system. Another word is monocyte macrophage system. Both are same. Okay, monocyte macrophage system, reticuloendothelial system, all are same. Okay, so the macrophages are lining the different tissues of the body. Like in liver, there are Kupffer cells. Like in bone marrow, there is the macrophage lining. In spleen, in the sinusoids, macrophage lining is there. So almost all the tissues of the body. In lungs, there are pulmonary alveolar macrophages. So every tissue, almost every tissue of the body is having that macrophage lining, right? So what it will do, it will take this free hemoglobin, okay, and it will destroy it. So that is another disadvantage of free hemoglobin. Then come to the another disadvantage is, if the free hemoglobin is there, then it will be taken up by the kidneys. It will be taken up by the kidneys. If it will be taken up by it will be taken up by kidney, then it will be converted into acid hematine form and it will be excreted out. Okay, free hemoglobin directly can also be excreted out. That is called as hemoglobin urea. Okay, understand the word carefully. Hemoglobin urea. Urea means urine, right? This is hemoglobin, means appearance of the hemoglobin in urine. Okay, so that is these all are disadvantages of free hemoglobin. That it increases the viscosity of the blood, so increases the peripheral resistance, so increases the blood pressure. Then it increases the osmotic pressure. If osmotic pressure of the blood is more, then it will take the blood from the interstitium into the vascular compartment. If it is taking more fluid from the interstitium into the vascular compartment, it means it will increase the blood volume. If blood volume increases, it will increase the blood pressure. It will cause rapid destruction. Free hemoglobin will be rapidly taken up by the reticuloendothelial system and it will be destroyed. Okay. Then free hemoglobin can also be excreted out via kidneys. Okay. And hemoglobin will appear in the urine. That is called as a hemoglobin urea. So these all are disadvantages of free hemoglobin. So it is good that RBC hemoglobin is present inside the RBC and it is not available free in the circulation. Yes, when RBCs are appear RBCs appears in the urine, it gives red color to the urine. It is in certain kidney diseases you will find. Okay, so it becomes red in color. Now come to the synthesis. Synthesis of hemoglobin. To synthesize hemoglobin, we need certain important substances like protein, different minerals, and vitamins. Now try to recall the component. Okay, if you try to recall the component hemoglobin, heme and globin. It means protein is important for the globin part, right? Because globin is made up of alpha and beta chains, right? So it will need it. Okay, amino acids are needed. So it means protein is important for the synthesis of globin part of the hemoglobin. Now come to the minerals. Different minerals are needed. Iron is needed, goes without saying, because we need iron in Fe+2 state. Okay, it is important part of heme, right? Then copper. Copper is needed for the absorption, mobilization, and utilization of iron. Okay, it is needed for the absorption, mobilization, and utilization of iron. Then cobalt. Cobalt is important for the manufacturing of vitamin B12 in GI tract. So for that, for the manufacturing of vitamin B12, we need cobalt. Then calcium. Calcium is important for iron absorption, right? So these all are important minerals. Iron itself is important because it is a part of heme molecule. Then copper is important because for the absorption, mobilization, and utilization of the iron, we need copper, right? Then cobalt. Cobalt is needed for the manufacturing of vitamin B12 in GI tract. And calcium. Calcium is important for the iron absorption. Okay, so these all are important, though they are required in minor quantity, except iron, copper, cobalt, calcium. They all are required in small quantity, but it is needed, right? Now come to the vitamins. Different vitamins which are needed. Vitamins like vitamin B12. Okay, we also need folic acid. Okay, folic acid and vitamin B12 are important for nucleic acid synthesis. Okay, so for all this, we need certain substances. Okay, for the synthesis of hemoglobin, now if we conclude, we need protein, minerals, vitamins, vitamin B12, and folic acid, iron, because it is Fe+2 form of iron is needed. Protein means we need amino acids for globin synthesis. Copper, cobalt, and calcium. One or other way they are important for vitamin B12 manufacturing and absorption of the iron. Absorption of the iron, transfer of the iron, and all. Right? So these all are the important components for the synthesis of hemoglobin. Now come to the different varieties of hemoglobin. Different varieties of hemoglobin are like hemoglobin A, hemoglobin A2, fetal hemoglobin is there. These all are dependent on the type of the polypeptide chain. Type of the polypeptide chain which is present in it. Adult hemoglobin HbA. Here polypeptide chain is to alpha and to beta, or other way you can say alpha 2 beta 2. Okay, alpha chain contains 141 amino acids, beta chain contains 146 amino acids. HbA2, it is approximately 2.5% of adult hemoglobin, you can say. Here, alpha, it is 2 alpha and 2 delta. Alpha 2, delta 2. Here, the difference only is the change in the sequence of amino acids. Change in the sequence of the amino acids will cause the formation of delta chain, right? So here it is alpha 2 and delta 2. Then fetal hemoglobin, it is represented as HbF. HbF. Here 2 alpha and 2 gamma chains are there, or you can say alpha 2 gamma 2. Okay, again here there is a difference is only of the polypeptide chain. Only polypeptide sequence is changed. Okay, so it is forming HbF. As the word says, fetal hemoglobin means the hemoglobin which is present in the intrauterine life. After birth, gradually HbF will disappear. By the age of 1 year, majority of the hemoglobin is HbA variety. Okay, it after birth it starts increase in the concentration of adult hemoglobin. So these all are the varieties of hemoglobin. Now I would like to put a stop here. Okay, and I will continue this topic in the next class. If you have any question, you ask me. If you have any question, you ask me. I will continue this topic in the next class. You are regularly receiving the timetable from the Unacademy daily. There is a timetable update. You can refer it. Yes, I little bit chat comes little late. Okay, so till now what I have covered, उन उसमें से मुझे आपको क्वेश्चंस बताने हैं. I would like to draw your attention for the important questions which can be asked from the topic till whatever I have covered till now. Okay, hemoglobin. See, reduced hemoglobin is important. Reduced hemoglobin, methemoglobin, iron converted into Fe plus 3 state. This is important. So it is not able to bind with oxygen. Glycosylated hemoglobin itself, it is something very common. Okay. Here glucose is attached with the terminal valine, okay, of the beta chain. HbA1c, it is represented as HbA1c. Its concentration is very high in poorly controlled diabetes mellitus. So this is important to remember. Calculation based question is there, important MCQ. 1 gram of hemoglobin, 1 gram percentage, or you can say 1 gram per dl. It can bind with 1.34 ml of oxygen when it is fully saturated. Okay, so if it is asked that 15 gram percentage is value, what is the oxygen carrying capacity, you can calculate it. So whatever the value is given, you multiply it with 1.34 ml of O2. So that much of ml of O2 can be carried by, that will be the oxygen carrying capacity. Okay, if we look at the function, the important recent one is hemoglobin can bind with the nitric oxide, okay, which is a potent vasodilator. So one of the important function now we can say is vasodilatation also. Disadvantage of free hemoglobin is important, short note also. Okay, or in 2 or 3 marks, if someone want to ask you, it can come as the Short note. Okay, so now you know all the important parts, right? Synthesis of hemoglobin, calcium is something important. Okay, calcium is important for the iron absorption. So this you need to remember. Then vitamin B12 and folic acid are important for the nucleic acid synthesis, right? So this you need to remember. Protein is the important part. Amino acids are important for the globin synthesis, right? Varieties of hemoglobin, HbF, alpha 2, gamma 2. HbF, right? It is alpha 2, gamma 2. Okay. And I will tell you the advantages of HbF in the next class. Thank you so much, Aisha. This means a lot to me. Thank you so much. Please stay connected. I really appreciate अगर आपको अच्छा लगता है पढ़ाना मेरा. I am really happy for that. So special features of HbF, I will continue this topic from HbF and onwards. Okay, in the next class. So this is all important MCQ. Please remember that. So study hard, study with us, study with me. Stay connected. Subscribe Unacademy Future Doctors channel and help us to reach to more and more number of students. Thank you so much.